The Republic of Korea, known by most Americans as South Korea, came into existence at the end of World War II as a result of the division of the Korean peninsula into northern and southern zones. Since this time, the nation has developed from a poor agrarian society into an industrialized, wealthy nation. South Korea is a representative democracy with both the president and members of parliament directly elected by citizens. As of 2012, South Korea had a population of approximately 49 million, 83% of which live in urban areas. Korea has a national health insurance system that was established in 1977 and has provided universal coverage since 1989. In the past, this healthcare system consisted of several hundred different insurance providers, but integrated into a single insurance provider called the National Health Insurance Corporation in 2000. The South Korean healthcare system is financed through a mix of public and private funds, both of which play an equally important role. Mandatory health insurance contributions and out-of-pocket payments comprise the funding for the system. Healthcare expenditure in the country is relatively low. As of 2012, the percentage of the nation's GDP spent on healthcare was 7.5%, in stark contrast to the U.S.'s 17.7%. Life expectancy at birth is 78 years for males and 85 years for females, which is among the highest in the world. The healthy life expectancy at birth for both sexes is 73, and the infant mortality rate is among the best in the world as well at just under 4 per 1,000 births. For nearly all measures of health, South Korea beats the world average.
Although not a medical professional himself, Dae-yoon lived in South Korea for a few years before moving to the United States. Now he's here, a sophomore at the University of Kentucky. What part of South Korea are you from?
I am from Daejeon, which is in the middle of South Korea, about middle, and it's about 2 hours south from Seoul, which is the capital.
Seoul being the capital,
Yeah.
okay. How old were you when you lived there?
I was about 7, and then I grew up there until 5th grade, which was when I was about 11 there.
12 there.
Yeah.
How many times do you remember actually being in contact with the healthcare system?
I was kind of young, so I don't really remember that much, but I think my parents took me in. I don't know. I think there are a lot more clinics than hospitals itself.
Like private practices and stuff?
Yeah, and you would just go in there and get prescripted.
So kind of like a Walgreens that we have here?
Yeah,
Something like that, it'd be a lot more.
Yeah, except it's cheaper.
And it's a lot cheaper there.
Yeah.
Was that what you say one of the main differences, the biggest difference between that and here would be the cost?
Yeah.
What are some of the biggest lifestyle differences that you've noticed between South Korea and the U.S. since you've been here?
I'd say in South Korea, you would everything's so the country itself is so much smaller.
Mm-hmm.
So we would walk around everywhere, travel places walking. And
As a kid?
Yeah, and we would go play outside.
So you had more freedom as a younger kid.
Yeah.
Than
And we wouldn't, we didn't play video games at all, and we would always walk to school every morning.
So you're outside all the time?
Yeah, and we,
Yeah.
I don't know.
Alright, what about some of the dietary differences? How is food different over there compared to here?
Well, we have a lot more veggies, I think, in our whole food things.
Like how so?
For our lunches, during school, back in elementary school, we'd have rice, soup, side dishes that were usually veggies.
Okay, so the rice was the heart of the meal and everything else
Yeah.
kind of go along
Yeah.
with the rice.
And you eat with it,
Okay.
side dishes. Anyways, and if you did get meat, any type of meat, it was kind of like a treat for the kids.
In agreement with Dae-yoon's comments about the Korean lifestyle and diet being generally healthier than the United States, the country's obesity rate as of 2009 ranked first among the 34 countries in the OECD at 3.8% in adults. Achievements of the South Korean healthcare system, including establishing universal health insurance coverage in a relatively short period of time and providing quality care to all with low health care expenditures. However, The country still faces several health care challenges. One of the main concerns of the nation is the extremely low fertility rate, which was 1.23 births per woman as of 2012. This ranks as the sixth lowest in the world. According to the CIA World Factbook, birth rates below 2 children indicate populations decreasing in size and growing older. Paired with high percentage of the population over 60, which is 16.58%, the long-term sustainability of Korea's national health insurance system is in serious threat, as well as the nation's other social insurance plans. In addition, like the United States, the nation must make the frame shifts from focusing on treating patients with acute disorders after the fact to preventative care practices.